the current data from CDC and with Johns Hopkins, the vast majority of patients who have severe illness or who are dying from this are in the elderly population or in the older population from 60 on, with the highest of that subset being people over 80.
Right. I've seen a lot of that, and I've seen a lot of people living in their 90s. I said, that's a beautiful thing, you know? So,
Right.
So it's just, is it because their immunity is compromised because they are older and they have pre-existing conditions?
Right, all the above. So when you have patients, the older they are, their immune systems are not as strong as a younger person. And then you have people who have other health issues, both of which put them at a higher risk of not doing well. Gotcha. So when you look at an 80-year-old or 70 or 80-year-old, anyone over 60, if you compare the strength of their immune system, on average, is not going to be as good as someone who's much younger. Right. Then you take on top of that they have other health issues like cardiovascular disease, chronic lung disease, things like COPD or emphysema and asthma, diabetes, that all compounds together and makes their outcome not as favorable as a younger, healthier person.
Got it. So I know these questions may be a little absurd, but we're going to address them because I've been seeing some videos coming on Instagram and Facebook. Lysol, spraying yourself with Lysol as a perfume or before you leave the house, effective or ineffective?
No, there's no evidence that spraying yourself with Lysol is going to help. However, what we do know is that the transmission of this virus is through aerosolized droplets. So, excuse me. So you will see that they can last on surfaces from anywhere from hours to days. Now, when we talk about decreasing or preventing ourselves from getting the virus, you do want to be concerned about contact contamination. So you do want to use EPA approved agents to disinfect these surfaces. So using Lysol, Clorox, things like that can definitely be helpful in killing the virus when they're on hard surfaces.
Okay. So, so Lysol is a good one. What about the generics, the kind that you can get like the General Value Walmart version or something like that?
Well, so what I've seen on CDC are they refer to EPA recommended cleaners. So there's a list. If you go to EPA.gov and search in the search bar disinfectants, it will give you an entire list of approved agents that have been shown to kill the coronavirus.
Got it.
So it's www.epa.gov.
EPA.gov. I'll have to share that on the show tomorrow. Okay, very cool. So this is another question that, you know, you may kind of be like, all right, now, where are these questions coming from? But a lady suggested that the virus is airborne, and being that we can breathe it in by the droplets in the air, she suggested you line the nostrils of your nose with Neosporin.
Yeah, I've heard that too. So there's no evidence that using an antibacterial agent to ward off or protect you from a virus. So there's no evidence to suggest that will be helpful.
Okay. And I think that's what a lot of people fail to realize, is that a virus and a strand of bacteria is two different things. Bacteria
totally
can
different.
be treated by antibiotics. Viruses cannot. Okay.
Correct.
Okay. Just wanted to go ahead and put those to rest. Now, getting back to the airborne illness, rumor and comments that have been being made, the Chinese government has said, yes, this is an airborne illness, but the American government has not said that. Okay,
so the current information that we know is that majority of the cases of corona or COVID-19 are spread through aerosolized droplets that can be passed through coughing and sneezing. There have been some reports that the virus can be aerosolized and can be in the air for up to 3 hours. Now, there is debate on whether it's actually transmitted that route, and that typically is not seen with coughing and sneezing, but in cases where there is mechanical manipulation with medical products, like during intubation, bronchoscopies, things like that. But what you mostly see in the community are going to be these the droplet spread through coughing and sneezing. And that's why it's very important that, you know, if you're sick, you try to keep your distance if you're coughing, you need to cover and protect yourself, protect the cough, or so you don't actually spread these droplets, which could actually reach anywhere from around 3 feet in distance with a cough and a sneeze. That's why we say that social distancing should be approximately 6 feet or further.
Got it. Got it. Okay. So, and so pretty much it is just somebody coughing or sneezing on you or on themselves and then touching you.
Right. Or surfaces. So when we talk about, protecting ourselves and keeping our hands clean, so when we talk about prevention, the most important thing that we need to do is wash our hands with soap and water, at least 20 seconds of washing. If you don't have that, you can use hand sanitizer, but the content should have at least 70% alcohol.
Okay.
And then
that's the first I heard 70%. I've been hearing 60%. So all my sanitizer is 62.
Right. So if you look at the CDC's website, it does say it clearly states 70% to protect you. So we know that. We know about coughing. We know about washing our hands. We know about social distancing. But a lot of times people forget about the hard surfaces that we talked about. So it's a good idea to disinfect the commonly used areas of your home or that you're around, like doorknobs, light switches, countertops, things like that.
Right.
So if they're dirty, you want to use, obviously if they're soiled, you want to use soap and water to remove the soil or the dirt, and then go back and disinfect it with an approved disinfectant.
Okay. So, all right. I received the package on Thursday. And I was very skeptical about opening my package from Amazon because somebody just tested positive in the Amazon warehouse. I Lysoled the package down, and then and I did so with gloves, changed my gloves. Once I did all that, got the product out, and then wiped it down with Lysol wipes. Is that a good measure, or you think I did too much?
No, I don't think you've done too much, but if you look at the transmission on products, cardboard, the coronavirus can live roughly 24 hours on a cardboard surface. So if you have packages delivered from other countries, the likelihood is very low that you can receive coronavirus transmission from those packages.
Right.
I don't think you did too much, and the reason why I say that is that you have to assume that the person who just touched your package could potentially be positive. So disinfecting the surface of that cardboard is helpful, but the package inside should be perfectly safe.
Okay, that's good to know. And I think it came, I think it came from the Charlotte warehouse, and that positive coronavirus was in New York, but it just kind of freaked me out because I'm like, listen, I'm already, self-quarantine. I'm not trying to, get sick from a package. You feel me?
Right. But to date, there's no evidence that there's been any transmissions from packages.
Okay. Well, that's good information to know. Does a mask help? A lot of people have been walking around with masks when they go to the grocery store and plastic gloves. Is that an effective measure?
Not an effective measure as preventing you yourself from getting sick, but we do recommend patients who are sick and who may be around other people to wear a mask to help prevent the spread of these aerosolized droplets out into the open. Just regular mask, but we also have to be careful. You see a lot of people going and trying to find these N95 masks that healthcare providers use, and we do not recommend that you do that. We have a significant shortage, so people, those of us who are on the front line seeing patients who could potentially have it, if we don't have the supplies that we need, then we can't provide the care that you all need.
Right, absolutely. Have you treated anyone with COVID-19 so far?
No, not yet. This particular strain, so we don't have any source of immunity at all. So that in and of itself poses a huge problem for all of us.
Gotcha. Gary Tracy is checking in and says, what about a husband and a wife? What is their self-isolation?
So if a spouse develops corona, we do recommend that everyone in contact with them in the home undergo self-isolation as well, because you have to assume that you have acquired, whether or not you have symptoms or not.
Gotcha. So, and another thing I've been seeing a lot of people on social media, they think they're sick, But they don't know if they're sick because of the pollen kick up and the allergy season is here early this year, or if they have, you know what I'm saying, something like a viral cold or, you know, coronavirus. So can you kind of explain the difference between if it's allergies versus if it's coronavirus?
Right. So if you're having, you know, itchy, watery eyes, frequent sneezing, no fever, you've had a reason for that. You know, let's say, for instance, you've gone out and mowed the lawn, and then you come back with itchy, watery eyes and sinus congestion. That's allergies.
Okay.
If you are developing fever, runny nose, shortness of breath, cough, then that's some type of infection. Mm-hmm. And at this point, we have to assume that it could potentially be the coronavirus, because there's no way as an individual you would know whether or not you have the flu versus a common cold or corona. So in those instances, if we're going to get a handle on this, we're going to need everyone who has those symptoms to self-quarantine themselves.
Right, right. And also possibly call their doctor based
Absolutely.
on how severe they are.
Correct, correct.
Okay. And a lot of times you don't have to go to the doctor's office. Like I know in Greenville, if I called you and I was your patient, you can call me in an electronic order to go through the drive-through and get the coronavirus test.
Correct. And what we're doing now, Prisma is starting to do virtual visits. So starting tomorrow, probably a large number of my patients are going to be virtual visits unless they have to be seen and I have to do an examination. And all of that is designed to decrease patient contact.
Okay. Got it. Got it. And for those that are just checking in, I see a lot of people coming in. We are talking to Dr. Dana Ray. He is a medical doctor. You've been studying medicine and practicing for how long now?
Oh, I've been in Greenville practicing for 22 years now.
Oh, come on. You look like you're about 22 years old. Stop
Thanks,
playing.
Kelly. Thanks, Kelly.
It's all good. Something we wanted to clear up, Dr. Dana Ray, is how long it does live on surfaces. I know you talked about it can live on cardboard up to 24 hours. Originally, when we started hearing about this virus, they said up to 9 days on hard surfaces. And then recently I heard just a few hours. I also heard a few days. So do we really know at this point?
Yeah, we're seeing that plastics can be roughly 72 hours, stainless steel roughly 48 hours, cardboard, like I said, 24 hours, and copper 4 hours.
Okay, got it. Yeah. All right. And B. Chester 61 says, can you explain how people have it but they have no symptoms? That's the part that bothers me. So of course, you know, a lot of celebrities have come forth and said, hey, I have it, I don't really have symptoms, but I was tested. Mm-hmm. So the first thing is, why are you being tested if you don't have symptoms? And then secondly, how can they have it without symptoms?
Right. So when you look at individuals like you talked about, celebrities, like Idris Elba was, he came in contact with a person who tested positive, so therefore he got tested, which the guidelines on that have changed a good little bit since he was tested. But what we do see is that there can be high amounts of viral content in an individual's upper airway, when their nose, throat, so forth, and they don't have symptoms, right, but they can still have what we call viral shedding. They can emit the virus even though they haven't had symptoms.
Got it. Okay. So does that mean that they just don't have any symptoms right now and they'll get them later, or they can actually fight this thing and never having any symptoms?
Well, it depends. So they could still be in the incubation period and still emit these viruses, or they may be an individual who has no or mild or very mild symptoms, which a vast majority of people will have very mild symptoms, if any, and yet at the same time they can still spread the virus.
Got it. Got it. So again, the incubation period is typically anywhere from 3 to 14 days.
Correct. So on average it's 4 to 6 days, but you can see it anywhere from 2 to 14 days.
Got it.
Correct.
Okay. Wow. So I mean, and I thought about that because I recently had to fly, and I was so nervous about flying. This was a few weeks ago. I refuse to get on a plane right now until all this slows down. But
right.
Once I hit that 2-week mark, I was, thank you, Jesus,
yeah.
you know, because you just
yeah.
never know. And when
right.
you get on a plane, like I remember telling the flight attendant, I was like, can you clean my seat? There's crumbs all over it. So if there's crumbs on my seat, who knows what we can't see, you know, and where it is. So yeah, so 2 to 14 days.
Right. And the biggest issue when you're talking about flying are the surfaces on the airplane.
Okay.
So, I was reading a study actually this morning that was talking about airplane transmission, and they said the highest risk are from surfaces. So the little tray top table that's in front of you, the armrest, these could all harbor the viruses, and then when you touch your face, then you basically have transmitted the virus to yourself.
Wow. And is it just, can it be transferred through pores, or is it just your mouth, your nose, or your eyes?
No, there's no evidence at this point that skin to skin, like touching your arm can do it. So face, nose, mouth, eyes. Eyes, because of our tear ducts, which have basically our entry point into your body. So if you have the viruses on your hands, and then you rub your eyes, and then it is transmitted to your tear ducts, then that's another entry point.
Right. And what
So
about
no evidence for that.
Okay.
And just like I tell my son, keep your hands keep your hands clean and keep them away from your face.
Right. Absolutely. Absolutely. So this question also came in last night. People wanted to know, could it be spread by toilet seats? And I won't go into the detail that the young lady left, but she said they say mucous membranes. We know that, there's parts below our waist that can be considered, mucous membranes. Can it be spread like that?
Well, remember, this is a respiratory virus. So gaining entry that way, there's no evidence at this point that is an entry point. However, if you get it on your body or on your hands, then therefore you will carry and then potentially transmit the virus to yourself or to other people through touching other surfaces. Okay. So I could see it that way, like toilet handles. If you touch the toilet handle and the viruses are there, now it's on your hands, and then you go from there.
Right. When I'm in public, I usually hit that toilet, that
with your shoe, with your foot.
Absolutely.
That's right.
And if they don't have that ability, it's a toilet tissue, and then I wash my hands, and then I open the door with the paper towel.
With the paper towel, right? Yeah.
Good stuff. All right. So there's this audio clip that's going around Facebook. People are texting it, inboxing people. It's a woman with a Spanish dialect talking about the coronavirus. She says that this is, what was, which was communicated to her people. And she said that the virus can live on your clothes and also in your hair. And it's important when you come home every day to take a shower, wash your clothes and your hair. Is that true?
Well, yeah, the virus can live on surfaces. So, every day I come home from work, the first thing I do is I take my shoes off in the garage, and I come in, and before I hug and kiss anybody, I go head to the shower. And wash my hair and shower and then change clothes and then wash the clothes that I've just worn to work.
So what about people like me who I just can't wash my hair every day, Well,
but the thing about it is you're not in a potentially high risk environment.
Okay.
So there's no recommendations that the average person should do that. But because I'm in a high risk environment, and I see a lot of, even in the last week or so, people who had what I thought were regular colds and didn't have corona were coming into the office to be seen, and not because we didn't have the ability at that point to do the virtual visit. So I considered myself a high risk, and then I took those necessary steps once I got home.
Okay. And you keep saying virtual visit. Does that mean you're like on FaceTime with somebody like you and I are doing right now?
Just exactly. So starting tomorrow, there are patients that can opt in to have an office visit with their Prisma Health doctors, just like what we're doing now.
That's
and
awesome.
Those are in instances, it's great. So, in those instances are cases or patients that need follow-up that I don't feel that doing an actual physical examination is absolutely necessary. But patients that need to have an examination, we're still doing their appointments. Now, I do have a lot of my elderly patients who are coming in or who are scheduled for routine follow-ups, and then I'm asking them just to postpone or reschedule those appointments until we could have a better handle on this, because they're at the highest risk.
Okay. All right. Derek Tracy is asking a question. He says, I work in healthcare. Do they need to wear a mask?
Well, it depends on what you're doing. So what we've done in our office, because we have direct patient contact every day, we've opted to, in a lot of cases, wear a mask to protect ourselves.
Mm-hmm. So it just really depends on if you have close contact to potentially infected patients.
Correct.
Okay.
Right, and it depends on what your job description is.
So if you're sweeping the floors, mopping the floors, taking out the garbage.
Yeah, in those instances, you're not going to have direct patient contact, but you could come in contact with contaminated surfaces. So
Okay.
wearing the appropriate gloves are going to be key for those individuals, and having disposable gloves that you obviously get rid of and not reuse, and then afterwards making sure you're washing your hands for 20 seconds.
Okay. And Gary chimed back in and said PCT is what they do. What is that? A
And
patient
that,
care tech?
right.
Okay.
So in those instances, the best thing is to, depending on the system that you're working in, it would be a good idea to talk with your supervisor.
Okay.
Mhm.
Direct patient contact. Okay. Thank you for clarifying, Gary. We
Right.
appreciate it. All right. Good stuff. All right. So we already talked about how you'll know if you have it, specifically a very high fever, a cough that won't go away,
Mm-hmm.
fatigue. Does it
Correct.
come with like muscle aches like the regular common flu?
Right. So muscle aches. So the most common symptoms that you're going to see are fever, cough, shortness of breath, fatigue, muscle and joint ache, and in a low population, but it still can have some GI or gastrointestinal symptoms such as diarrhea. But the most common, about 87, 88% of patients will have a fever of
Okay.
some sort. And it doesn't necessarily have to be a very high fever, but just they will have a fever.
Okay. So I saw this, this actually was on one of these news stations where a doctor who contracted the COVID-19 said that on the fourth or fifth day, it's chronic diarrhea. And they say that's why we ran into this toilet paper shortage issue because of what he tweeted. Is that something that people, I mean, do you think that was exaggerated? Do you think, I mean, I'm confused on this one because I'm still
I
trying to
can
figure out why all the toilet paper's gone.
Well, well, if you look at the CDC's list of symptoms, GI symptoms are one of the least likely to have. I can't remember the percentage, but it's very low. I think it's under 5 or 10%. So the vast majority of patients who have COVID-19 do not have diarrhea.
Yeah.
Now, what people are doing, in essence, as far as in regards to your statement about toilet paper, they're just overly stocking, anticipating quarantine, which we don't recommend that people do.
Right. Okay. Got it. Anita says, what about people who test positive and they never had a fever? Or can you test positive without having a fever?
Yeah, you can. You can, and then in those instances, you obviously want to self-quarantine yourself for 14 days.
Okay.
So yes, it is possible to test positive and have no fever or any other symptoms.
Got it. Mel Parker wants to know, what about people who have pre-existing issues such as diabetes? How does coronavirus affect them?
Right. Those individuals who have other what we call comorbid conditions like diabetes and heart disease and chronic lung disease have a higher incidence of having more severe symptoms, and
Okay.
oftentimes requiring more medical attention, such as hospitalizations and potentially ICU stays.
Got it. Okay. All righty. So at one point, a lot of people thought this was being blown out of proportion by the media and the government. Would you agree or disagree?
Totally disagree.
Okay.
And I think a lot of that had to do with the fact that there was lack of knowledge of what was going on. So what we've seen over the last month or 2 months is how rapidly this has spread,
Right.
and the number of severe cases and the number of fatalities associated with it. So no, I don't think this is sensationalized. I think this is a very important topic, and I don't think it's been blown out of proportion.
Okay. Do you think that what we're doing as a country is the right thing as far as closing the schools, the malls, and so on and so forth, non-essential businesses?
Absolutely, absolutely. So if we want to gain control over this as quickly as we can and as best as we can, we all have to take that personal responsibility of distancing ourselves. So that means, closing of the schools, non-essential workplace, or businesses will hopefully slow down the rate of transmission because it's patient contact. So the more likely we are together interacting with patients or interacting with other individuals, the greater the transmission, the likelihood we're going to spread it to each other.
Okay. So others are asking, if we didn't do this with Ebola, H1N1, the swine flu, and so on and so forth, why are we doing it with coronavirus?
Well, it appears that the coronavirus transmission or the ability to transmit itself is greater than a lot of these others. Now, when you look at Ebola, I mean, the fatality rate initially was 100%, and I think it got down to around 90%. And with Corona is much less,
Right.
but the spread is a lot easier.
Got it. Okay. How long does the coronavirus typically take to run its course? Once you've contracted it, how long does it stay in the system?
Mild symptoms about 14 days. Severe symptoms can be anywhere from 3 to 6 weeks. So you're looking at those patients, those most critically ill patients who are in the ICU or who've been on the ventilator. They can go as long as 3 to 6 weeks. Mild cases, on average, we're looking at 14 days. That's why we're telling people to quarantine yourselves for 14 days.
Wow, that is a long time, 2 weeks.
and most of them don't last that long, but you can see symptoms that can last, the cough.
Right.
Fever usually doesn't last that long, but the cough, which is a method of transmission, can last that long. So that's why we're saying 14 days.
Okay, so 14 days from the first day that you experience a symptom or from the day that you're diagnosed?
Well, that would be from the time you experience symptoms. So we're looking at symptomatology. So we're looking at how long that people can potentially have symptoms can be up to 14 days.
Okay.
Now, but if you're looking at how long people have had it, the incubation period is longer prior to having symptoms. So, how long you have it until the time that you have no more symptoms would obviously be longer than 14 days.
Got it. So I've heard a lot of millennials specifically say that, if I got it, I'm going to just stay home and fight it like I would fight the flu. No need to get a test. Do you think everyone needs to get a test that is experiencing the symptoms?
No, not at this point, unless your symptoms are severe, because we only have a finite amount of tests, and we actually don't have enough tests, and we're reserving those tests for patients that have severe symptoms, or knowing that diagnosis will alter how we manage them.
Got it.
So if you are an otherwise healthy person and you're having, cough and fever, we recommend that you quarantine yourself and not necessarily get tested. Okay. But if you're a high-risk patient, or if you have symptoms that are worsening, including shortness of breath, those are the ones that we think are best tested, because you could see those people get sick very quickly and will need medical care at that time.
And again, high risk is 60 and above, pre-existing health conditions. Correct. Like high blood pressure, diabetes,
correct.
Asthma,
correct.
COPD. Okay.
Correct.
All right, got it. So we already covered how you can be tested. If you do think you have it and your symptoms are severe enough, you call your doctor. There are a lot of drive-through sites. By the way, big kudos to Greenville, South Carolina. Greenville, South Carolina beat Charlotte, North Carolina to the drive-through testing sites. I don't know how that happened, because Greenville is a smaller city than Charlotte, and you would have thought, but Charlotte, to my knowledge, they still don't have that capability, but it's coming this week. But Greenville, I think ever since Monday of last week, we've been having the drive-through. So,
right.
Shout out.
And I have to applaud the people at Prisma with spearheading and trying to get the rapid testing done so quickly. So they've done a great job.
Definitely. And shout outs to the folks in Southeast Texas checking in too. They just got their first drive-through site on Wednesday, and it came through a private health practice as well, Legacy Community Health, which is privately funded. And that's really the wave that we're starting to see, is these smaller, medical institutions are the ones that are really stepping up during this coronavirus. So shout outs to them. I know Prism's a big hospital system too, though, but so big ups to them. This is coming from somebody on Facebook. If you test positive, are you given any type of medication, or are you told to just self-quarantine? So is there medicine involved? Well,
yeah. So you are told to self-quarantine, and then we treat your symptoms. So, with cough, high fevers, you do want to suppress the cough. High fevers, typically, fever, a lot of things, that's a misunderstanding. Fever is not necessarily a bad thing. So fever is a way that our bodies help fight these pathogens or these germs. Mm-hmm. So a lot of times, if you have a mild fever, anything below 102, we recommend you just kind of, if you don't feel bad, just kind of ride it out. But we obviously don't want to get too hot.
Right. So ride it out without taking any medicine.
Yeah. If you have the muscle and joint aches and you want to take something like Tylenol to kind of help alleviate those symptoms to help you feel better, then that's okay.
Okay.
But if you're walking around with 100, 101 fever and you don't feel terribly, you basically handcuffing your immune system by suppressing that fever. I have patients all the time. They'll come in and say, "Oh, I had a temperature last night of 100, and I immediately took Tylenol." And I go, it's probably not a good idea. I just kind of let your body do its job. It knows exactly what to do because these germs don't like those hot temperatures.
Right, right. I'm so glad that you said that because a lot of people don't understand that. And, I look into natural healing and homeopathic remedies too. And I always was a firm believer that if it's not 104 or 103, let your body fight.
You don't want to get too hot because you could have some organ injury related to those really, really high fevers. So if you have a mild fever and you feel okay, a lot of times we just encourage you to just watch and just wait and see how you do.
Right. Okay. Somebody else says, correct me, I have a fever of 99.1. Is that classified as a fever?
Well, it depends on the time of day. So just kind of if you get into the upper 99s or 100s, that is considered a low fever. And then it depends on the time of day too.
Okay. Another young lady says, I had a collapsed lung in the past. Am I considered high risk?
Well, it depends on the reason for her lung collapse. If it was related to trauma, probably not. If you there are certain underlying chronic lung problems that would increase her risk of having a collapsed lung. In those instances, you may be at a higher risk for having more severe symptoms if you were to develop the coronavirus.
Gotcha. Another common question, and there seems to be a lot of controversy behind this one. If you catch it once, can you catch it twice? So if I caught it, God forbid, can I catch it again?
I see a friend. I see a friend of mine, Chris can guard me.
Yes.
Okay, I answer that in a second. So I see you, Chris. So could you be exposed to it? So after the first exposure with any pathogen, you're going to build antibodies that your body will then remember, and unless it mutates, you'll have some type of immunity to a certain degree. Could you be exposed to it again? Sure. So if I developed corona, got over it, and met another person and they sneezed in my face, could I get it again? Yes. However, I would be exposed to it again. However, you probably will have milder or maybe no symptoms because now you have antibodies directed specifically to that virus.
Gotcha. Kind of like catching the flu. You can catch type A and type B, but you're typically not going to catch the flu twice in the same season.
Right. But you could still, just because you've seen it does not mean that the virus cannot enter your body again. It will, you will have either no symptoms or very mild symptoms because you have antibodies.
But you also can pass it on to others even if you don't have the symptoms.
Correct.
Okay. Got it. And I want to get your honest opinion and thoughts on grocery shopping and ordering takeout, because we know all the restaurants are closed, but when I think of takeout, I think about that person that's in the kitchen cooking my food, the person that packages it up in the bag, and their fingerprints, handprints, all of that is all over it. The person that takes my credit card to run it for payment, that's like 3-4 different people I got to go through to get my food, and I feel like that's just as much of a risk. Would you agree or disagree?
Right. So there's no evidence to date that the virus is transmitted through the food. However, you have to be aware of the packaging. So if a person who has corona and didn't wash their hands or boxing up your pizza, then obviously you could have the viruses on the box. So you want to be careful in how you handle the box. Once you get home, make sure you're washing your hands for at least 20 seconds to rid yourself of the virus. But there's no evidence to date that I've read that says that the actual food items themselves can transmit the virus over to us.
Okay, prime example. I go to Harris Teeter and I pick up a mango. Typically, when I pick up my mangoes, I touch them. I massage them a little bit to see if this one is going to be more firm or juicier than the other one. sometimes I put them back until I find the right mango, because I need my
Right.
mangoes to be perfect. So
Right.
if I or someone else chew and they're massaging mangoes, not even thinking, when I get home and touch that mango, can that be a way that it can be transmitted?
Right, on the outer coating. And that's why we recommend that fresh fruit and vegetables, that you actually wash them before ingesting, which actually helps in decreasing the transmission.
So even though it's not soap involved, just washing them with water?
Correct. And
Okay.
that's per the CDC's recommendation on their website. Yes.
Okay. Someone wants to know, are they working on a vaccine for it? And also, will the vaccine come before the cure?
Well, we haven't been able to figure out how to cure us from these family of viruses. So I don't think that is on the horizon. However, a vaccine, there you have multiple companies that are working on a vaccine.
Okay.
I know the information that's out there, or has been out there, is that we could potentially have a vaccine within a few weeks or a couple of months. On average, it usually takes a year to a year and a half before vaccine is created and undergoing the trials necessary to prove that it's safe and effective. So, don't get your hopes up. I don't think we're going to see a vaccine anytime soon.
Wow, that's crazy. And you said just